As you know, things are changing rapidly. It may be necessary at some point for us to actually, for me to issue an order to close restaurants and bars. So at this point, we are working together, the mayors, as well as county commissioners, as a community, to try and find solutions that take into account the needs and the circumstances of a number of different people. We know that there are actions being taken by Congress, hopefully this week, to provide direct funding and direct support for folks who may find themselves out of work. And this could be a direct consequence of the order that I issued last night. Hopefully that will be minimized by the steps we've taken, but nevertheless, we stand ready at the county as a social service agency under Florida statute to help people get through this challenge. What I'm hoping is that Congress will act quickly and provide funding to us directly. What we don't need is a federal program that's based on reimbursements like FEMA. We need money to go directly to people, and I've sent the message to my lobbying folks to get that bill drafted in a way that does that. I want to thank Mayor Castor in particular for her team working with us to begin to find a way to bring together various food banks, various other private social support agencies to provide feeding and to provide other immediate needs. However, that only takes care of part of the problem because people have to pay rent, they have to pay all their expenses, and that's really where we need that direct influx of cash from the federal government. So fortunately, the county is in good financial shape. We have strong reserves that we can draw on. However, we have to be aware that we are soon approaching hurricane season. So we have to balance the amount of reserves that we currently use to get through this crisis with what we may need to deal with storms. So that's something that we're currently working on to try and find that proper balance. Excuse me. So in addition to the order that I just described that I issued last night, I'm also going to be issuing an order today that limits the size of gatherings, both public and private, across the entire county. So my order related to restaurants and bars relates to the entire county. It's what gives effect to the executive directive that Mayor Castor issued yesterday. But in addition to that, we do have to be aware of the necessity of social distancing. Sometimes that's working well based on people's personal responsibility, sometimes it doesn't. And so to be absolutely sure, the order that I'll be issuing today will provide that both public and private events and gatherings throughout the county will be limited to no more than 50 people. And that would apply to across the board except to businesses who are taking different steps as we are, and I'm sure many of the governments represented here are doing, to send people home to work from home. So the order I'm talking about just relates to, it does relate to churches, it does relate to any other organization that has a public or private event in the county. Chose 50 as the limit because that's currently the CDC recommendation. I know that the President and others have suggested 10, but at this point, I think my best source of information is the CDC, and if they should change that advice and reduce, then I will probably do the same accordingly. The other thing that I do want to mention, of course, many of you are aware of it, the WWE did yesterday issue a press release saying they will be canceling WrestleMania here. So that was a very important step, and that relieves us of having to make that decision. However, I would have been very much prepared to do that. So I did mention that it's very important for people to take personal responsibility. So that message is really the same message that we all give during other disasters. We stand ready, we're united, we have resources, we have skills, we have everything we need to be there to provide support for the community. However, this particular challenge, this particular disaster really does require more personal responsibility. And that especially goes to businesses to be sure that they can provide, whenever possible, the opportunity for workers to work from home, to conduct meetings by phone whenever we can. That's what we're doing at the county. Find different ways to provide service. And then, of course, all the things that you've heard over and over again, wash your hands, et cetera, et cetera. I don't have to repeat that, but all of those things are something that we all have to do on our own. We have to remind each other to do that. The only way that we get through this is by taking that responsibility, by encouraging others to do so, and that will make a big difference. The other thing that I want to talk about just briefly, and I don't want to get into too many details because they're currently being resolved with the private healthcare providers in our community. We have had, and again, I appreciate Mayor Castor's leadership in this as well. We've been working together with the major healthcare providers in our community. You know who they are: Baycare, Advent, TGH, and others that I won't mention, on the subject of testing and collection. So the other thing that's really important, in addition to the things I just described, is to find out who is a carrier of the disease, who's ill, and the only way to do that is through testing. It's very helpful that the federal government has taken action to speed up the production of testing kits and take all the other steps that are needed. However, on a local level, the challenge is how to safely gather those samples in an efficient way, but without putting healthcare workers at risk. So we had a conference call yesterday, a couple of conference calls. There's been discussions going on with the Department of Health. I think we are at a point where we can stand up very quickly drive-through sites, which have been proven, I think, so far to be the best way to accomplish both of the things I mentioned: protecting healthcare workers and getting an efficient collection sample. And so the city of Tampa and the county have been identifying sites that we are standing up now, and many of them are already prepared to provide these drive-through services. The other advantage of a drive-through is that the healthcare workers who are collecting the samples don't have to change their protective gear every time they see a patient, because they're driving through and they're just doing the tests one right after the other. There is a shortage right now still of protective gear. That will change, but that solves a big problem. What the private healthcare providers are doing now and have been doing is setting up the medical infrastructure to make sure that while we're doing these quickly and we're being efficient, that we don't lose track of the important medical paper trail, because you have to then be able to get back to someone whose test has been taken to let them know, or let their physician know. The other challenge is to bring together those physicians and healthcare facilities that are not part of the large institutions and who don't have necessarily the capability. They were on the phone as well. This is coming together. It's going to be in place very quickly. But I want to be sure that, before we make any major announcements, that our medical community is absolutely prepared and ready to undertake this. Um, I think at this point, I'll stop and ask if there are any questions. Those are the major issues I wanted to let you know about and let you know that we are acting in a unified way. This is changing rapidly. We're adapting rapidly. We're learning a lot every day. And so we will be at this for a while, but I can tell you our commitment is to keep our community safe and do our very best to work with our medical community to do that. So at this point, I'll answer any questions that you may have. Yes, sir.
Mike, how quickly are you ready to stand up the drive testing? Today, tomorrow?
We're in the call yesterday. We believe that the medical protocols will be in place by tomorrow. We're already preparing the sites, so very soon, this week definitely, hopefully by before Friday. Yes, ma'am.
How does the county plan to enforce the 50 people public gathering limit, and is there like a plan of action as far as enforcement?
Right, so I think what I will do is turn that over to Sheriff Chronister and of course, Mayor, if you know, for speaking for the Tampa Police. It's not going to be easy. Clearly, you know, we can't devote enough uniformed police to cover every single event, but we did talk about it yesterday, and Sheriff and Mayor, if you want to weigh in on that, just to give your thoughts.
We started, clearly we're asking for everyone's consideration and cooperation in all of these orders that have been put out. We put out a notice of no large gatherings on Sunday afternoon, and we had our police officers go around to over 100 locations, provide those to either the managers or the owners, those notices, and then get their name and telephone number. And so, you know, trying to get people to cooperate, and if it takes a little bit of a nudge, then we're doing that as well. And the majority of the locations have been very, very cooperative. A couple of the bars in Ybor City have already texted me and let me know that they're just shutting down as opposed to limiting the number of individuals in there. So we're not going to go in, you know, with a police state and start arresting individuals, but we'll get their cooperation.
No different in the county. We're certainly the last thing we want to do during a declared state of emergency is put people in jail unnecessarily. So we're focusing on the education and awareness portion of that. We have the luxury of working with county code enforcement. I think a huge and tremendous deterrent is when you talk about an administrative fine that may be placed on the business or suspension of their liquor license. So I think those have greater consequences than us giving them a notice to appear and to deal with an infraction at a later date. But once again, we're certainly at this time, any declared state of emergency, the last thing we're focused on is putting individuals in jail and any type of detention. Matter of fact, we're focusing on just the opposite, making sure unnecessarily there's not people in our detention facilities or going through the court system that don't need to be right now, knowing that with the court system operations being constricted, and I should say restricted, the last thing you want to do is put any unnecessary burden on them.
Sheriff, are your deputies going to also enforce the restaurant and bar rule as well?
Yeah, 100%. No, these orders are enforceable. This is no different than if this policy group elects to implement a curfew. You know, that's enforceable. That's something that we'll be asked to do. I think I want to make something abundantly clear. When you look at all the hard work of the individuals behind me, you know, it's trying to find that fine line between public safety and freedom. At this time, I think we developed a wonderful starting point. But I think everyone would be foolish not to believe that as this spread of the virus continues, these orders are going to become more constrictive. And that's going to happen as we focus on public safety, which is what the tremendous task the daunting task that we're tasked with during these times.
I just reiterate what Sheriff Chronister said. I think, you know, part of the difficulty that people are having is that, unlike a hurricane, so this is a disaster on the level of a hurricane. But with a hurricane, you can see the pictures, you can see the hurricane coming, everyone's familiar with it, and there's a different sense of urgency. Here, it's the opposite. It's a tiny little bug that no one can see, and all you see are people getting sick. But we don't see many people getting sick in our community like in other communities. And so there isn't, I don't believe, the same sense of urgency. But if people think about it this way, that in the context of what we're familiar with, a hurricane, if we had the opportunity together as a community to take steps to actually take a Cat 5 hurricane that's heading for us and reduce it to a Cat 1, you can bet that everyone would be doing everything they could. That's what we're doing here. We're doing all this, we're taking a Cat 5 disease and we're taking all of the opportunities we can to effectively dilute it. And I think that's the way people need to think about this. And that really, I think, then helps people understand personal responsibility. The other thing I want to mention in terms of people who need help, I talked about social services. Those who need assistance go to the county website, hcfl.gov, and go to the social service link. We can, there you will find all of the typical social services that we provide, whether it's help with rent, help with utility bills, and so forth. Our economic development people, as I know, the City of Tampa folks are working very closely with small businesses and with others to provide loans. There is a loan program that was released by the governor yesterday. And so again, go to our website and connect up with our economic development people. We are reaching out to businesses. We're not waiting for people to come to us. But for those who need immediate assistance, that's the best portal, that's the best way to get to us. Yes, sir.
Do you think, in your estimation, sir, that they'll ever have to issue an order like they did in San Francisco?
I'm not going to answer that yet because I don't really know, and I don't want to put that in people's heads right now. I mean, I think, as I said, we have the opportunity as a community to get ahead of this, and we don't have to be a San Francisco at all. The testing will really help a lot. That's been the missing piece here for DOH, for Dr. Holt. That's going to change rapidly as we start to get a better sense of who's infected and who isn't.
How are we doing on getting tests?
I'm sorry?
How are we doing on getting test kits?
The test kits, because of the action taken by the feds, test kits are now becoming available. Our healthcare facilities here in the county do have an inventory for some period of time, but again, it depends on how quickly those get used. We are pushing as hard as we can to procure both testing equipment and protective equipment. That goes through the state emergency management. They then are working with the feds, with the major corporations that are actually producing the kits and the equipment. So it's kind of a chain of supply.
Do you know if any of our ICU beds are taken up by COVID-19 patients at this time?
I do not know that, no.
Are you planning it's probably hard to plan for a time frame of how long these restrictions will last.
Yes.
Is there any internal debate right now, let's do this, it's probably going to have to last a month or 2 months, or is this literally a day by situation internally?
It's day by day, and so when you look at the CDC website and you look at other authorities, they have a lot of guidance, but actually the website that that Canada has was particularly helpful. They stress the fact that you really need to look at every community on its own, because every community is different, and how all of this guidance gets applied has to be geared towards, you know, the number of cases, the demographics, the geography. So we are really looking at it on a day-to-day basis, and that's why I said, you know, the orders that I've sent out yesterday and today could change in a couple of days. but we are just watching it every day. Anybody else? Would anybody like to say anything at all? No? All right, thank you so much, and we will certainly keep you posted.